So if you have an asymmetry of your face, so one side of your face goes weak, you have weakness or numbness of either your arm or leg, and if you have disruption of speech. Those things are things that, this is the one medical condition where if you are thinking there's even a remote possibility you're having a stroke, you need to seek medical attention right away, because you're losing 1.9 million neurons every minute that you wait. And so, and there are options that go off the table if you're out of certain time windows from when your symptoms start to when you actually seek medical care. So heading to the emergency room, calling 911 is the most important first step.
Now, most of these things occur in people over 65, some 2/3 to 3/4. It's important, and hopefully we'll have time to talk about what happens to the younger crowd when that happens. But a lot of that group has aches and pains and things aren't quite right, and they kind of just, you know, they want to blow it off sometimes. Sure. Is it the person who's having the stroke that knows it, or is it somebody who's with them that notices it? How do most of these get found?
Yeah, it's a terrific question. So for minor strokes, often people have insight into the fact that they're developing a new problem. But you're right, more than any other disease, it's a third-party observer who's going to recognize this person's not quite right. And actually, one of the real challenges in stroke care is usually the person who's having the problem thinks they're fine. And so they really resist seeking care and wanting to actually get in that ambulance and go to the emergency room. And so you can be a real advocate for your loved one or your friend if you realize something's not right, and you actually force them to actually seek medical care in that situation.
I had it happen once. My mother-in-law, the side of her face was starting to go down, and I'm like, we have to go to the emergency room. And she fought me. I'm fine. What are you talking about, you know?
Yeah, you're exactly right. And I can't emphasize enough that it is the best everyday opportunity to really save someone's life, because they're often largely in a position where they can't help themselves. The brain's the part of the body that tells you moment to moment that you're okay. And so when that's the organ affected, you're in a situation where you're really relying on the people around you to recognize that and get you to appropriate medical attention.
Even if it's not a full stroke, are there warning strokes? Are there red flags that God's sort of sending you saying pay attention?
What you're describing is something called a transient ischemic attack, or a TIA. And that's a temporary interruption of blood flow to the brain, but that occlusion or that blockage is restored before that part of the brain actually dies. We do have a window of time before that brain dies where we can actually get that handled. That tends to happen with certain types of causes of stroke more than others. And so if you're dealing with a structural vascular problem, a blockage of the carotid artery like we talked about earlier, that's classically associated with a TIA. That can also cause a window shade to come down in your vision from a lack of blood flow to the eye. So those kind of warning signs definitely put you at higher risk for a larger or more permanent stroke.
So if it kind of comes and goes, don't ignore it.
No question, you need to seek medical care right away, because that's essentially, you're being given a rare window of opportunity to fix that problem before that major stroke sets in.
Somebody's calling.
Yeah, exactly.
Okay.